Hello, readers. Mark Gentili here, the editor at Sudbury.com. We tried to do this live conversation a little bit earlier. Unfortunately, technical difficulties got in the way of our efforts. So we've recorded this conversation with Aaron Archibald, the director at Pioneer Manor here in Sudbury, and we're going to release it now as a recording. Unfortunately, we couldn't do the live conversation, but you know, sometimes these things happen when you're trying to go live. So, Aaron, I want to thank you for joining us here on Sudbury.com today.
Thank you, Mark, for having me.
So today, the Ontario Health Coalition released a report where they tried to aggregate all of the outbreaks at all of the long-term care homes in Ontario, and they came up with some pretty sobering numbers. I just kind of wanted to throw these numbers at you if I could. 436 deaths, 3,783 infections among staff and residents, and approximately 80 large outbreaks at homes across Ontario. Those are some pretty sobering numbers, and I guess we can all understand why people are concerned about their loved ones in long-term care homes during this pandemic.
Absolutely. So those numbers really illustrate the measures that we have taken and put in place here at Pioneer Manor, and more broadly our community in the city. Mm-hmm. Since early February, actually in late January, we started meeting on our COVID-19 response. And in February, the province started releasing their initial documents and screening protocols. And at that time, we implemented our pandemic plan. And since then, we have continued to implement additional measures to safeguard our residents here.
Okay.
Our number one priority here at Pioneer Manor is the safety of our residents, our staff, families, and anybody that should visit our home. As you've articulated, COVID-19 is a very serious threat to frail and the older adults that have multiple underlying medical conditions.
Yeah, as we've seen, it seems like the older a person is, the more susceptible they are to contracting a severe case of the virus. Can you give us an idea for people who are unfamiliar with Pioneer Manor? I think it is the largest long-term care home in Sudbury. How many staff and residents are we talking about here, Aaron?
So our home is one of the larger homes in the north. We have 433 residents that live here. And approximately, we have about 550 employees. And we also have about 160 or so volunteers. And we have 4 attending physicians, one of whom is our medical director.
Okay. Now, this week, the Premier Doug Ford announced that he was going to take some, be sort of seeking federal aid for long-term care homes in Ontario, including potentially calling in the Canadian Armed Forces. What's your reaction to that step that the Premier says Ontario needs to take?
Well, I certainly understand from just reading the news reports from down south, what those homes are going through. I can tell you here, internally, our response has been, implementing our plan and ensuring that we have all these measures in place. We're very fortunate at this time that we don't have any COVID-19 in our facility. We continue to aggressively use surveillance measures and testing on anybody presenting with any symptoms. And we're also very fortunate being a municipal home that we are linked with the rest of the city. And so as you know, the city through the mayor's office has declared a state of emergency. The city has also enacted their emergency operations center, and there is a community control group of which members of the public sit on, or important stakeholders, I should say, our HSN, our public health unit. And so from Pioneer Manor and from the city's perspective, there has been coordinated response to COVID-19. And so we're funneling information up to my boss, the general manager of community development, who is sharing information with the executive leadership team and the mayor's office through a coordinated approach every single day. And so we're very fortunate right now that we have a strong plan. We've enacted that plan, and we continue to care for our residents.
Okay. I'd like to talk a little bit and get a bit more info about what that plan looks like actually on the ground. One thing the Premier has said is that he wants all staff and residents of long-term care homes to be tested for COVID-19. What status is Pioneer Manor at in that regard?
So we've been aggressively testing all residents that have been showing any symptoms consistent with COVID-19 for more than a month. And we have been working with Ontario Health, which formerly Northeast Lynn, our public health unit, and we are testing as we speak right now, everybody.
Okay. Now when you're saying you're especially keeping an eye on people who start to show symptoms of having the virus. When that happens, I'm kind of curious about what happens with the resident. Like if a resident begins experiencing symptoms of COVID-19, sore throat, cough, fever, those sorts of things, are they isolated from the rest of the population? Are people experiencing symptoms, are they kept separate from those who aren't? Like, how does that work?
Yeah, great question. So our pandemic plan addresses that. Now, what's really important to just also mention is the fact that outbreaks, whether they be respiratory or an enteric outbreak, are not new to long-term care. And so any resident that is showing signs of a respiratory symptoms or enteric have always been isolated, and we have the appropriate protocols and processes and protective equipment in place to ensure that doesn't spread throughout our homes. So that has always been going on. For our pandemic plan, though, we've taken it obviously a step further where we're doing aggressive surveillance monitoring and testing. Now, what's really important is that we have worked very closely with HSN and with Ontario Health Berlin on stopping and slowing down our admissions into our home, and we've built capacity in Pioneer Manor. As we speak right now, I have 9 empty rooms, 7 of which are private. Our plan, our pandemic plan, is scalable, meaning we have a plan if we just have 1 resident, we have a plan if we have 2 residents, and we have a plan that will encompass multiple residents. At the end of the day, our plan will be to isolate an unwell resident from the well residents. And then we will dedicate staff to just that area. And so by having surge capacity, empty beds, private rooms, we have the ability to ensure that we will move any of our positive residents into one area and just deliver specific services to them there so that we can limit any type of transmission throughout the home. And so that's really, really important to mention. And we were able to do that through strong partnerships and leadership right from the CAO and Mayor's office and dialogue with HSN to ensure that we were able to build that capacity. And we have it, and that's where we're at right now.
Okay, so brings me to sort of 2 questions. So if you're isolating a positive resident, does that mean that that staff are also isolated as well? So there are certain staff, if there are staff who are providing care to someone who is positive, that staff does not interact with residents who are not?
Correct. So the overall plan, if we move beyond 1 resident, we will be dedicating staff to just that area. Again, it's a scalable approach. If you only have 1 resident, we will try and dedicate obviously staff to just that 1 resident. Thinking larger though, if we have to move multiple residents into 1 area, again, we will be utilizing dedicated staff through a dedicated entrance and trying to limit any type of cross-contamination or transmission throughout the home. This is a very large home, and we have to put processes in place to make sure that we can segregate that area to ensure that we don't transmit. So we do that now if anybody's on a respiratory outbreak, but we're going to be taking it to the next level given the type of virus that we're dealing with now.
Okay. Now, one thing I've noticed that, you see these heartbreaking reports, I'm going to use the Pinecrest home Bob Cajun example, where you get a very large outbreak, multiple staff, multiple residents who are sick. Are residents provided care solely in the home, or what's the point where a resident is transferred to hospital?
Great question. So we are meeting weekly with our medical director and our physicians, and there was a recent announcement a couple of weeks ago at the Premier's office that anybody that has COVID will be seen in the hospital. And so right now, our practice is anybody that requires a medical assessment that needs to be seen outside the hospital will be treated and transported. And I would like to highlight that, again, community partnerships. Our medical director has been in constant communication with other physicians within the community, within the province, and nationally. And what we're doing is we're learning lessons learned from other parts of the country and implementing those practices here to ensure that we're providing the best care for our residents. And one of the things that we've done is we now have firmed up, obviously, a direct line where our physicians can call right into the emergency room and speak with a physician there, even before we transport. So they are prepared. They know that what will or may be coming, and they're able to appropriately be prepared and respond for that resident. So right now, if a resident requires medical attention at the hospital, they will be absolutely transported and treated in accordance with, obviously, their care plan and wishes of their family.
Okay. On the subject of families, we've seen quite a number of posts from people suggesting that they may want to remove their loved one from a long-term care home during the pandemic to keep them safe from any potential outbreaks. Are you getting questions like that from family members? And is that something that Pioneer Manor or you as the director would recommend that people do, that they remove loved ones from the long-term care home to keep them safe from COVID?
We have been fielding some of those questions. Families have been reaching out and asking questions with staff, and I have spoken to some families. Understandably, people are afraid, and so we are doing everything we can to properly and timely communicate with all our families. We've been updating our website now. We have information on the Pioneer Manor website. We have a dedicated email line for families when we're sending out communication so they can respond in. And, right now the province has put a stop on non-essential visitation, so families can't come in. And that also means that residents can't leave for non-essential visitation. It really depends on the resident. It depends on the care that they need and the care that the family can provide. So there's really no easy answer. What we do is that in our conversations with the families, we start to ask them about what is your plan? What processes or people are your ability to provide care for your loved one at home. Recognize that people that live in long-term care right now, they're here because they have exhausted all of the community supports and are no longer able to have that support in their home. And so we've had some conversations. It's not here anyway. We haven't had a lot of people. We haven't had removing their loved one.
Okay, so could you reiterate for our readers and our viewers what that dedicated email is?
Certainly. So we have a dedicated email, and off the top of my head, I can't recall what it is.
Okay.
Maybe I could send that later to you in an email.
Sure.
What we've done is we've sent that email link out to our family members, and every time that we communicate with them now, we have a dedicated email so that they have one point of contact to send their information in. Now, recognizing also families, they know who the nurse leader is in their area, and that's where they're most comfortable communicating with. So most families are actually reaching out to the home area that their loved one lives in. They're talking to the nurse leaders there, and they're getting that information there. But we were just trying to be proactive and have multiple avenues to get information out there.
Okay. Just let me see if I get this straight. So under the emergency order that the province has issued, does that mean families cannot remove a loved one from a long-term care home at this time?
No.
Okay.
So they can't. What a family can't do is they can't come and pick their loved one up and take them out to, take them home for a couple of days. And you can absolutely come and have a resident discharged and take them home.
Okay.
Yeah.
But it would have to be for an extended period of time. Is that what I?
It would be a discharge.
Oh, so they would be out of the home, like they would lose their spot.
They would be discharged home.
Okay.
And if they wanted to come back into a long-term care home, they would have to reapply and go through that process.
So this wouldn't be a small decision for families to make then. They would have to have ample supports in place to be able to provide the care that their loved one would have been receiving in the home, in the long-term care home.
Absolutely. That's exactly it. And that's part of that conversation that our nursing staff and physician will have with the family to make sure that they're making an evidence-based decision and they are fully informed, and that we, through talking with them, ensure that they have the proper support to meet the needs of their loved one. And right. So I can tell you right now, Mark, overwhelming support from families. It has been nothing but positive. I have been receiving all of the communication I've been receiving from families up until this point has been thank you. Thank you for all the measures you've put in place. Thank you for caring for our residents. We feel safe. We understand and recognize the processes that you've put in place. And so that I think is really important that my experience has been very positive with the families.
Okay. Has anyone removed their loved one from Pioneer Manor during this time at all, or?
We have had one person, but it was they've also moved to Southern Ontario. So it was
okay.
So this was not just I'm taking them home. This was part of a planned discharge to another area in the province to be closer to their family.
Okay. Just going to switch gears on you a little bit, just on the subject of personal protective equipment for staff and everyone. Pioneer Manor stores in that regard do you have enough PPE? Do you have all of the protective equipment that you require? Is there any shortages? Any issues there?
Good. We are doing very good. So on important note, the province and the Northeast LHIN have 2 logistics tables, we'll call them supply arms, set up specific for long-term care. And so we are receiving PPE through our normal distributors, gloves and gowns, and they're coming in at various rates, and hand sanitizers and cleaners. When we are unable to procure through our normal process, we have the ability to either link in with our Northeast region and submit an order. They have warehouses and they are distributing PPE to homes right across the province. And to give you a number, on April long weekend, the province filled over 100 orders for long-term care homes that week. And so this week we've received masks. We've been receiving masks and gowns and gloves through our normal distributors. So right now we have a full supply of personal protective equipment. And if we run into a situation where we need more, we have the ability to go through the Northeast LHIN or through the province.
Okay. Now, I'm kind of curious about what the mood is like inside of the long-term care home, inside of Pioneer Manor at this time. Among staff, among residents, when they see, granted, Northern Ontario so far, there have been few outbreaks at long-term care homes. There was just one in Sudbury, just announced just this week at St. Joseph's Villa, where a staff and a resident both tested positive. But Southern Ontario, the situation is much different. We've seen a lot of outbreaks at long-term care homes in the south. So I'm kind of curious what the mood is like inside of the long-term care home at Pioneer Manor at this time. When you see these reports, I mean, is the mood tense? Are people upbeat? Are people like what's the mood like?
Concerned. People are very concerned. I'm concerned. We meet regularly with our union executive. And I just had a meeting with them yesterday. We meet every week. And so we're keeping our finger on the pulse of our staff. I can tell you right now, staff are coming to work. They are concerned, but there's a lot of laughing going on. They're caring for their residents. Inside, I have to tell you, I'm honestly deeply moved that we have great staff, compassionate staff that are caring for our residents right now. And yes, people are watching the news. We're watching and seeing what's happening in Southern Ontario and throughout our country, and it is deeply concerning. But I got to tell you, I'm really impressed with the support that I've had right from all of the city, from the mayor's office and our CAO, ELT. We have redeployed some city CGS staff here to help do some non-care related work. So we have some people doing some screening and just tasks that I've been able to give them to reallocate staff out on the floors to make sure that we have enough staff out there caring for our residents. And overall, the mood has been very, very positive. It's truly is, healthcare is a team sport, and that's where we're at right now.
Okay. Is there I'm just kind of curious about sort of internal mechanisms that keep residents informed. Is there a newsletter that goes out? Are there bulletins issued to residents so that they're aware of, the situation in the home and all aspects of this pandemic? How are residents kept informed besides, the news itself? But are there sort of internal mechanisms that help keep residents in the know?
Yes, there are. So under the Long-Term Care Act, every long-term care home must have a resident council, which is members of elected residents onto that council, and also a family council, family members that are there to ensure that we're disseminating the right information. So we've been communicating with our resident council and with our family council, and we've also been putting together what we did early on and have done it several times now. We've been putting together Q&As. And what we've done is our life enrichment staff have Q&As with frequently asked questions. And we've been going on the floors and sharing that information with staff. So we're with residents, trying to get as much information out as possible to our residents, recognizing it is a large home. And we do post information in various areas, whether it be the website or internally in the home. But we've been, ensuring that we're getting the right information to our staff so that they can, in turn, answer questions by the residents in the moment.
Okay. I won't keep you much longer, Aaron. I have sort of curious about one more question. That we've heard it said that the pandemic has kind of highlighted pre-existing sort of systemic issues in long-term care in Ontario. Was that a fair assessment of the situation?
Overall, certainly, one of our challenges has always been recruitment, and we're very fortunate that we. Prior to the pandemic, we've had more staff than we've ever had. We've been very aggressive in our recruitment strategy. And just this week, we've brought on 16 new staff. And so the last couple of days, we've had people in orientation, and they're going to be on the floors this weekend doing their orientation shifts, and will be on the regular schedule. But overall, throughout the whole system, one of the areas that we've had to modify and change is the fact that, you have a lot of part-time staff working in multiple sites. And so we were very aggressive early on. In early March, we started surveying our staff and having that conversation early on. I wanted to know who's working where in the event that this gets to a point where we have to make some changes. And so we implemented that, and we've been about 10 days or so since that it has been in effect. But that does highlight one of the issues is that, facilities have been sharing employees. So that will be something that will have to be addressed at a later time. But we've been very fortunate now because by limiting, what we've done is we've taken an employee or a person-centered approach. And so I've been endeavoring to ensure that the staff that haven't been able to work 2 jobs, I'm giving them additional hours. 1, because we need that on the floor, but 2, recognizing that person was dependent upon that second income. And so we didn't want to disadvantage anybody, so we asked them to choose where they wanted to work. And if you chose to stay with us, we would do our best to get you the hours and make sure that you're taken care of or made whole. And if you chose not to stay with us, I gave them a leave of absence. Because again, I don't want to be punitive and I don't want to hurt anybody in the middle of a pandemic. Now is not the time for that. We should be standing shoulder to shoulder as a community caring for our residents.
Okay. One last question. Ontario's action plan that the Premier announced a short time ago for long-term care homes. Is this did it come at the right time? Did it come? Was it a case of too little, too late? I mean, or is Ontario's response to the situation in long-term care homes been fast enough, been accurate enough, been appropriate?
Question. So the province has been pushing out information early on. The first documents came, I believe, in February 3rd, and we've been quick to enact those recommendations and directives. And the action plan highlights the future goals, and we're well ahead of that and moving in the right direction. So Pioneer Manor has been very, very quick to act. The city's been quick to act through strong leadership at the highest levels, and we continue to be focused on our number 1 priority, which is caring for our residents and caring for our staff, and providing high quality, compassionate care to 433 people who call Pioneer Manor. This is their home.
Excellent. Aaron Archibald, Director of Pioneer Manor here in Greater Sudbury. I want to thank you for your time today, and thank you for your insights and for bringing us inside Pioneer Manor to give our readers a bit of a better picture of what's happening in the city's largest long-term care home.
Thank you, Mark. I appreciate it.
Great. Take care. And readers, for all your COVID-19 news and all of the other news you may require, head over to Sudbury.com. There's something new every time you log in. And for all of us here at Sudbury.com, I'm Mark Gentili.